Hi guys, we are welcomed back once again to Joan Academy. In this video we look at the different bones of the upper limb, so let's enjoy. The bones of the upper limb are grouped into four main groups: the bones of the shoulder girdle, the bones of the arm, the bones of the forearm, and the bones of the hand. The bones of the shoulder girdle are the scapula and the clavicle. The scapula is a triangular flat bone that serves as an attachment site for a whole lot of muscles. Anteriorly, we have the clavicle, which is a flat bone that articulates with the sternum, thereby making it possible for the upper limb to be attached with the axial skeleton. On the arm, we have the humerus. The humerus provides skeletal support for the arm. It articulates proximally at the shoulder joint and distally with the bones of the forearm at the elbow joint. Both joints have been discussed before. Do check them out. The bones of the forearm consist of the ulna, which lies medially, and the radius, which lies laterally. The radius pivots around the ulna to produce movement at the proximal and distal radii-ulnar joints. The ulna plays a stabilizing role in the forearm. As for the bones of the hand, they include the carpals, metacarpals, and phalanges. The carpals are 8 bones arranged into 2 rows located within the wrist area. They articulate distally within the 5 metacarpal bones, 1 for each digit. The phalanges are the bones of the digits. Each finger has 3 phalanges, apart from the thumb, which has only 2. Having understood the different bones of the upper limb, let's take them one after the other. We start first with the scapula. The scapula is also known as the shoulder blade. Like we stated earlier, it articulates with the humerus at the glenohumeral joint. It also articulates with the clavicle at the acromioclavicular joint. In doing so, the scapula connects the upper limb to the trunk. It is a triangular flat bone that serves as a site for attachment of 17 muscles. This bony has 2 surfaces and 3 borders. The 2 surfaces are the costal surface and posterior surface. The costal surface can also be called the anterior surface. It is the surface of the scapula that faces the rib cage. It contains a large concave depression that is known as the subscapular fossa. The subscapularis, which is one of the rotator cuff muscles, originates from this fossa. Originating from the superolateral surface of the costal scapula is the coracoid process. It is a hook-like projection which lies just underneath the clavicle. 3 muscles attach to the coracoid process, which are the pectoralis minor, coracobrachialis, and the short head of the biceps brachii. The posterior surface of the scapula faces outwards. It is a site of origin for the majority of the rotator cuff muscles of the shoulder. It is marked by the spine, acromion, infraspinatus fossa, and supraspinatus fossa. The spine is the most prominent feature of the posterior scapula. It runs transversely across the scapula, dividing the surface into 2. The acromion is a projection of the spine that arches over the shoulder joint and articulates with the clavicle at the acromioclavicular joint. Infraspinatus fossa is the area below the spine of the scapula. It displays a convex shape. The infraspinatus muscle originates from this area. The supraspinatus fossa is the area above the spine of the scapula. It is much smaller than the infraspinatus fossa and is more convex in shape. The supraspinatus muscle originates from this area. As for the borders of this bone, like we stated, it has 3 borders, which are lateral, superior, and medial. The lateral border of the scapula faces the humerus. The shoulder joint is seen on this side, and it is also an attachment point for various muscles. Important bony landmarks of this bone are the glenoid fossa, supraglenoid tubercle, and infraglenoid tubercle. The glenoid fossa is a shallow cavity located superiorly on the lateral border. It articulates with the head of the humerus to form the glenohumeral joint, which we commonly know as the shoulder joint. The supraglenoid tubercle is a roughening that is immediately superior to the glenoid fossa. It is the point of attachment of the long head of the biceps brachii. And finally, the infraglenoid tubercle. This tubercle is a roughening immediately inferior to the glenoid fossa. It is the point of attachment of the long head of the triceps brachii. The superior border is the shortest and the thinnest border of the scapula. It runs horizontally along the top of the bone. The medial border of the scapula runs parallel to the spine and is also known as the vertebrae border. Let us look at the articulations with this bone. The scapula has two main articulations. They are the glenohumeral joint and the acromioclavicular joint. The glenohumeral joint is between the glenoid fossa of the scapula and the head of the humerus. We commonly refer to this joint as the shoulder joint. The acromioclavicular joint is the joint that is between the acromion of the scapula and the clavicle. Clinical relevance of this bone is fracture to the bone. Fractures of the scapula are not very common, and if they do happen, it is an indication of severe chest trauma. They are frequently seen in high-speed road collisions, crushing injuries, or sports injuries. The fractured scapula does not typically require fixation, as the tone of the surrounding muscles holds the pieces in place for healing to occur. In our next video, we will look at other bones of the upper limb. Support Joan Academy by subscribing to this page and also sharing this video. Expect more from Joan Academy.